A good way to welcome you to the issues where we talk about matters that concerns, matters that matters. And every Thursday, of course, we talk about healthy conversations in line with our health. And today, again, in partnership with General Hospital Ikorodu, we will be having this conversation today, talking about the World Contraception Day. Actually, some days back, just recently, I think on the 10th or thereabouts, we had the World Contraception Day, talking about contraception. And it's important. This is an awareness. This is a campaign all over the world that you also should be a part of. This and many more we will talk about today on the issues, alongside with my guest in person of Dr. Rabiu Fatima from General Hospital Ikorodu. We would have a very short break. When I return, the issues begins proper. Good morning, Lagos. My name is Okpeyemi Adebambo, and when we talk about contraception, you would want to agree with me that starting a family requires proper planning. However, it is very, very unfair for the unborn generation to come into the world without you having a proper plan for them. That is why it is important that we have proper planning when we talk about family planning. This brings us to our conversation today, talk about the World Contraception Day. But first off, I would open the air for my guest in person of Dr. Rabiu Fatima from General Hospital Ikorodu. Good morning to you, ma.
Good morning, moderator. Good morning, everybody, and all viewers at home.
Thank you very much.
Happy to be here this morning.
Thank you very much. It is good to have you in the studio again. So talking about the World Contraception Day, this is another form of campaign. This is another form of awareness, creating that consciousness in the minds of family people. When we talk about the family people, especially the husband and wife. But in most cases, from this part of the world, it is always seen as the responsibility of the wife, the mothers, the women, that they are the ones that should know. There are cases where we even hear a man who will confidently say that it is not my fault that we are having so many children, at least if my wife is doing what she's supposed to do. I want to believe that this is supposed to be an agreement, a cordial mutual agreement between both parties. However, to start up this conversation, let's start from when we say contraception. Contraception in itself, how best can we describe contraception?
Thank you very much. Starting with the word contraception, it actually means something that is against conception. Contra is opposite of something. So if we say contraception, we're actually saying something that mitigates against conception. But it has so many synonyms, because a lot of people are averse to, I don't want to do it. The way it sounds is like I want to interfere in God's doing in my life. So we can decide to call it child spacing. If you want to have 2, if you want to have 4, if you want to have 10, space them. So contraception can also be referred to as child spacing. It can also be referred to as family planning.
Okay.
It can also be referred to as planned parenthood. Like, I want to plan my family. I know I want to have 2, 3, 4, but I want to space them. So a lot of people have some reservations about it. But for us to be sincere and to be truthful to everybody concerned, it is for the benefit of the woman, her husband, and even the family, and even the community at large. So anything that involves you spacing your child, planning when you want to give birth again, spacing your children in order to cater for other things, are all under the umbrella of contraception. So it is not a bad thing. It's actually a very, very laudable thing that the family needs to put in place before they marry and when they are married. So contraceptions are a broad way of saying ways by which you can plan your family to optimize the reproductive health of the woman.
Thank you so very much. Thank you so very much. Earlier, I said that the World Contraception Day was observed first way back 2007, precisely 26th of September, and this is how it is done every year. To spread awareness about this contraception. Now, there is a belief, there is this mindset that contraception has to do with women alone. So I want to ask Dr. Rabiu Fatima that is contraception majorly for women? Is it something that it is a woman's doing? It is your thing, do your thing.
Thank you. It's not a woman's problem. It's not even a problem.
Okay.
It's not a woman's palaver alone. Like the theme of the World Contraception Day, which was celebrated 2 days ago, 26th of September precisely. The theme of this year's World Contraception Day is the power of options. I'll repeat. The power of options. The power of options. So that goes back to your question. It is not a woman alone. It is not the wife alone that needs to do contraception. There are other forms. There are several methods. It's just that the many methods that are available, a lot of them are the ones that will be done by a woman. But we have a lot that is also very, very workable for the men. So it is not just the woman that needs to family plan. It takes two to tango, the husband and the wife. We have methods for the women. We have methods for the men. It is just that the methods for the women are much more than the available ones for the men. So we want to implore our men that all these available methods, you sit down with your wife, your spouse, and you talk about it, and you pick a method that is best for the family.
I would like for us to talk about the methods, other words we can say the types of contraception, because this is another thing we need to know. In as much as this conversation is quite very sensitive, it is also important for us to talk about it. So for every family person out there, be you male or female, husband or wife, this conversation is not just for the female gender alone. It is for both sides. Now, before we talk about the methods or types of contraception, one that I would want to quickly ask you, Dr. Rabiu, is that they call the discharge method. You know, is that also a form of contraception? You know, is that a form or a type of contraception when you say, because this is like one regular method we know and people are already tagging it as a type of contraception?
Well, I don't know if that's what everybody calls it, but what we know, they refer to it as contraception in the natural sense of it is what we call the withdrawal.
The withdrawal, yes. I think that's the original word.
Yes, withdrawal. Is a form of natural contraception, when the man, I just want us to use simple words, I don't want us to go so much raw. When the man's organ is actually erect and is about to ejaculate, instead of him ejaculating into the private part of his wife, he now withdraws. So that's what they call withdrawal method. Like, I'm taking it back. So instead of putting everything into her, he brings it back. That method is a natural method, but it has up to like 99.9% failure rate. And I'll tell you why. Even though it's a natural way and we prefer things that are very natural, as small as an atom size of sperm, can actually move up. So even if when the man has withdrawn and he feels, he's putting the sperm somewhere else, even as little as a drop that falls on the thighs of his wife, it can move up. Because the sperm can move, the shape of the sperm, the movement can be so fast, like the speed of light, and it will go inside the woman's tract. And the man will say, but I withdrew. Yes, you withdrew, but there was still an atom of sperm that got his way inside the female reproductive tract of his wife. So it is a natural method which a lot of people like, but it fails a lot of times. So we don't rely on it.
It's not reliable.
It is not reliable. Some will claim it works for them, but according to statistics, the failure rate is as high as 99.9%.
99.9%. Yeah. Okay, now we have types of contraception.
Yes.
Another one that I want to quickly ask before you tell us the medical types is the one that some ladies, now we've talked about the man part, the natural part, which is withdrawal method. Some women will also tell you that, okay, I could just use this drug, without prescriptions, right? So is that also another method, another form or type of contraception, where a woman will just decide to mix this with this one, the yellow capsule and the blue capsule, and then boom, the baby is not coming, we are good to go?
A lot of people do different things, and you'll be amazed when you hear what they say. Some will say it's just like a small tablet, a seed. I'll put inside water. Some will say I'll tie something under my pillow, and they will tell me to prevent me from getting pregnant. All these things are funny in the sense that they don't ever get this kind of methods from professionals. All these funny methods are from all these iyalagbos on the road, people in the bus selling different things. And because our health is very important, we cannot joke with it. So when it comes to things of contraception, definitive method, you need to visit your doctor, your gynecologist, or your family planning provider. So all those things. Meanwhile, there are some certain pills that women abuse. As we go along on the talk, I will mention it. There are some things we call emergency contraception. However, some women have abused that privilege. They've taken it to be their own normal form of contraception. And what that does to them is that it causes an imbalance in their hormones. So they won't even know. They won't be able to say, oh, this is what caused it. But they have forgotten that they were abusing certain pills. Ladies that use it know the pill. The pill starts with P. I don't want to mention brand names now. But all those things are meant to be used for emergency purposes. Like, for instance, maybe they were supposed to use male condom. They used it, and the thing along the act, it burst. So they'll be afraid that, oh, she might get pregnant. They can use that emergency
just
pill
to be on the safer side.
Exactly. Or maybe there was a case of rape, and you don't want the girl to get pregnant. They bring the child to the hospital. We give the child that kind of emergency pill. But unfortunately, our ladies have abused it, and later on in life, it can even give them a risk of things like cancer. So my advice is, don't use things that are meant to be for emergency purposes. Use them as normal, because on a longer term, the sequelae will be that it's going to affect you.
My place of interest actually is what you just talked about briefly. That is the emergency contraception. This has been abused so much. Now, if you're listening to the issues today, we are talking about the World Contraception Day. This is in line with this awareness, and of course, General Hospital is here to enlighten the general public on how important it is for us to go through this contraception process if need be. However, this is to say that this conversation belongs to those that are in the family line, okay? That is for our fathers and our mothers. Now, in as much as Dr. Rabiu, you say that contraception is something that is good, is advisable and all, I know you would want to agree with me, if I'm not mistaken, that there are other risky measures to it. There are effects to it. We hear people just come out and say that after I did one particular method that I was told I was given this. In fact, it was in the hospital they did it for me. And then this is happening. My tummy is becoming bigger. I can no longer sit well. Before we look at all of that, because we have so much to talk about today, first off, if you have said the withdrawal method is not so safe, now tell us medically, what are the types of forms or methods of contraceptions that you can tell us about?
Okay. We'll go about this categorizing the forms of contraception this way.
Okay.
One category is what we call as natural method.
Okay.
Versus artificial method. All right. Another category is male contraception or male contraceptive methods versus female contraceptive methods. All right. So let's start with male, female. So under male, female, we will also have natural and artificial.
Okay.
So let me take the broad categories again. We have natural methods, artificial methods. You can also refer to those as non-natural. All right.
Okay.
Natural methods, artificial methods, male methods, female methods. So all of these categories, they intertwine. So I can have a natural male method. I can have an artificial male method. I can have natural female method. I can also have natural female method. I can also have artificial female method. The male methods are very few, so let's quickly browse through. For the male method, the natural one is the one we mentioned earlier. We call it withdrawal. That when the man is erect and is about to discharge, he withdraws from his spouse's private part for him to pour the sperm somewhere else. That's the natural method. Another natural method for the males is what we call abstinence. But it doesn't work most of the time because when the man has the urge, you can't tell him not to go on to his wife. So even when the wife is not in a safe period, we'll get to that time. There are some certain periods in a woman in her menstrual cycle that we tell her, oh, you are safe to have sex during this time. You might not get pregnant. But because of the urge of a man or even the urge of the woman, it can be at any time. So abstinence is not so easy for husband and wife. So it's a method that is below the belt, okay? But it's also a method. That's for the male. Now, the artificial method for the male include one, male condom, which we are all, most people know that, okay? And the male condoms have different types, some are made such that it's not going to remove the feeling you are supposed to feel. Because what some people complain is, I don't want to chop banana with the peel.
I like it flesh to flesh.
Yes. So that's an excuse for them to say, no, I don't want to use the condom. She's my wife, for crying out loud. But there are so many brands in the market now that they have different flavors, chocolate flavor, banana flavor, and they are ultra sensitive. You will not even know you are wearing anything. So the male condom is very available, is affordable as well. It's just that some women complain that no, they just want it without it, even some men. But for such people, they can buy the ultra sensitive brands. So that's an artificial method for the male. Another artificial method is what we call gossipol. All right?
Gossipol.
Yeah, it's a pill. Gossy. Gossipol is a pill from cotton seed. It's like the woman taking pills. So they are actually contraceptive pills available for the men.
For the men too
yes,
as well.
But for them to now have compliance with the pills is the headache. So those ones are actually non-permanent methods, okay? The condom, the gossipol pill. At times you can actually give the man some hormones. All right, you can give them a particular hormone called testosterone to act against them producing sperm. Those are artificial methods that involve barrier method, which is the condom, that involves hormonal methods, the pills and some hormonal injections. Also, there is a surgical method, which is a permanent form of contraception.
Still for the man.
Still for the man. We call it vasectomy. I'll break it down.
Please do.
Yeah. There is a particular organelle in the reproductive system of a man that we call vas deferens. It's a tube. Just picture a pipe of water, conveying water to your tap. So that's the same pipe. That vas deferens is the pipe that takes away sperm, all right, for it to be discharged into the woman. So but we do what we call a mini procedure on that organelle. Organelle means a smaller organ. What we just do is to clip it off. Left and right. There are two of them. So we clip it off. Yes, we clip it up on the right. We clip it off on the left. So the man can be ejaculating, but the thing is not going to pass out. So he's safe. And it does not affect his action in the other room. It does not affect his urge. It doesn't reduce it. It doesn't cause any harm to him or his wife. The only disadvantage in that is some men will now feel, well, I'm free. So even if I sleep with 10 side chicks, I'm sure, so no side chick will come and lie to me that she's pregnant for me. But all these methods, we sit down the client or the customer or the patient to talk to them about it. For the condom, it's even having an edge over others because it protects against things like sexually transmitted infection or diseases like HIV, like hepatitis B. Unlike vasectomy that is permanent method, the man will not be able to impregnate his wife at all anymore. And we usually don't reverse that method because once we clip up the tubes, that's permanent.
So that is like for life.
For life. So we need to sit them down and make sure they understand the pros and cons of each of these methods. So that's for the man. You can see the methods for the man are so short and brief, but we need to counsel them on the particular one. There's no side effect for vasectomy. The only thing is it doesn't prevent against STDs. Unlike barrier method like male condom.
Mm.
All right, or like abstinence or like withdrawal.
Mm.
So there are always two sides to a coin. It's just like every drug has its own side effect.
Mm.
Even the paracetamol we take for headache has some side effects. But when the benefits outweighs the risk, then you go for it because
One
of
of
the
the only
benefits.
major risk, I know people at home would want to ask you that question when we get to that point where we open the phone lines, but some people will want to know, just like we have women who take some of these contraceptive pills, and then we have reactions. We'll get to the women part.
Yeah.
But now that you're rounding up on the male
Male.
part, so let's also add this to it. The only thing that you mentioned that we are seeing as, okay, maybe this is the side effect, that is when the man decides to take advantage of the vasectomy and then he tries to misbehave and all. Medically, aside that, are there any other side effects like maybe swollen tummy and not enjoying the sex? And do we have any other thing aside maybe he's cheating on the wife?
We actually call the method sterilization method, all right?
Okay.
And that what it means is that you are now sterile. But it doesn't affect you from having the urge you normally have. It doesn't reduce it. It might even increase it because you are happier. You are like you can score
I'm
your
safe now.
In fact, you can score your goal at any angle, at any number of times. Your mind is at ease. You are not afraid that she might get pregnant. Oh, do we have to go and abort? So it's just that it is a permanent method. It's not a method that you now come back 2 years later and tell us that I want to impregnate her again. If you want to do that, there are other ways. We'll just send you for what we call IVF. All right.
Okay.
So all these methods are methods that we need to just cancel you, and you know that you are ready for it.
Let's leave the male side because we have so much to talk about.
Yeah.
The women are there to hear now. But how affordable is this for the male part? Because the way you're saying it seems to be very expensive.
It is not expensive.
Okay.
Not expensive at all. It's in fact, for the vasectomy, it's a procedure that can be done under 10 minutes. For a very fast surgeon, maybe 5 minutes. Now, what we even do, we don't do like a big opening everywhere anymore.
Okay.
We just do like what we call a microscopic procedure. We just put a point on the skin. We search out the vast difference. We bring it out.
I'm trying to picture this. You gave an illustration of a pipe.
Yes.
Where we look at the pipe and then you just clip this side, you clip this side.
Yes.
So that man has to start working with two clips. The one clip from the right and the left. And then he's carrying that everywhere. How comfortable will it be?
Now, a lot of us did biology and we
Okay.
know how the organs of a man is, okay? God made it such a way, science will say nature, that even the scrotal sac is placed under where there will not be heat affecting the testicles, all right? So even those vast differences are around that place. So the surgery is just like putting a pin, just a pinpoint.
Wow.
Yeah, bringing out under microscope and just clipping. Clipping, it doesn't mean I'm applying a clip.
Oh,
It
okay.
means I'm occluding. So that's what that does. As in, I'm stopping the passage of that sperm. So it's not as if the man will start carrying things
Clip up
about.
and
Yeah,
down.
the thing is just going to just heal. And when it heals, there is no communication between the two ends of the pipe anymore.
Let's talk about the women now. The natural versus the artificial and then the major ones. But let's start with the women first.
Yeah. Okay. So like I categorized earlier, for the women, the natural ones include one. There's a method we call safe period. Okay.
Okay.
Or some people can decide to say unsafe period. Safe period means there's a particular time in your menstrual cycle that it is safe for you to have sex with your husband and you will not get pregnant. All right? So in other words, that works for a woman that has a regular menstrual cycle. A woman can either have maybe 28-day cycle, 29-day cycle, 30 days. So you need to know your own cycle. That method is not good for a woman that has irregular menstrual cycle, all right? Will not be good for her because there can be miscalculation. Even when we do mathematics in school, we make a lot of mistakes, all right?
Yeah.
Now, that method also does not affect the woman in the sense that it can be any time. However, what if the husband has a urge during the time the woman is unsafe? So you can't use that method alone a lot of times. You might still have to add other methods like the barrier method. Okay, so that safe period we also call it there's a we call it Billings method. Why we call it Billings method is there's a particular man that devised a sort of thermometer that once the woman puts it and she sees her temperature is a particular value, she knows around that time that okay, she's not ovulating or she's ovulating. All right, and that also involves a woman having a regular menstrual cycle. There is another one we call lactational amenorrhea. What that means is the woman has given birth, all right?
Okay.
She's breastfeeding, and as she's breastfeeding, her menses has not come back.
Okay.
You know, a woman gets
Due to the
pregnant.
pregnancy period.
Exactly. So that works well for a lot of women. In fact, as long as 6 months. In fact, I have patients that 18 months, as they're still breastfeeding the child, because some breastfeed up to 2 years, they have still not seen their menses. So lactational, you know, lactation means the woman is feeding, breastfeeding. Amenorrhea means absent menses. So the method is lactational amenorrhea. The woman is not seeing her menses because she's still breastfeeding her baby. That's a natural method too. Even though it's good, but it fails in some patients. Because even though they've not seen their menses, it doesn't mean they have not ovulated. So it's natural, it's good, but the sensitivity is not very high. Another natural method is what we call the cycle beads.
Cycle beads.
Cycle beads. Like just imagine all these beads ladies use, a round bead, and some part of the beads are colored like white, while some are colored like red. Those red types, red beads, indicate when the woman is menstruating. Red blood, all right, when she's seeing her menses. So she picks on it. Some will flow for 7 days. Some ladies will flow for 5 days. But she points on the cycle beads each day of her flow. So after that, there will now be some white beads. Those white beads tell her that, oh, immediately after, she's safe to have sex with her husband. But by the time she gets to another color, that one will tell her, no, you are not safe around this time. So don't meet your husband around this time. It's an old method, but imagine we are in the villages. That might be a method that we need to give to the ladies for them to understand, explaining to them. So those ones are the natural method for the woman. Yeah. Now, the artificial methods, there could be, for the woman too, she can abstain, no, but it's not easy. You know, men are still begging the women that, Ahaba now, why are you starving me? When some women have a roster for sex, they will say it's once a month. Some will say it's twice a month, you know. So when the men are still begging, please allow us. So abstinence is another method, but of course it's down the belt as well. Now, for the artificial method for the women, we have what we call the hormonal methods, all right? Hormonal method, we all know what we call hormones. It could be in form of injectables, like injections, all right, that we put. It's not painful, it's just some pinpoint. It's as if mosquito just bite you. They are not painful at all. There are some injectables that the woman comes every 2 months. There are some that she comes every 3 months, all right? Those ones are even old methods, all right? Now, all those injectables, they come under what we call hormonals. Now, there are some things we call implants. Those ones, just for those of us that still use matchstick to light up our gas, we are not using the other method. Just imagine those matchstick. That's what we call implants. Very small, just like 2 cm long, all right? So they put it under their skin, on their arm. If they are using right arm, they will put it on the left arm, under the skin. Those ones too are called hormonals. There's a particular one we refer to as implanol, right? That one takes a period of 3 years. There's another one is Jadel. That implanol is just 1 stick, all right?
Okay.
The Jadel is 3 sticks, and that one takes up to 5 years. They are also under hormonals, okay? And it's not painful. It's just like putting something under the skin. However, some women complain that it makes them fat. Some women complain that they have irregular menses. Some women might not even see their menses at all when they're on some of these hormonal drugs, okay? So at times when they complain about being fat, we tell you what's even your own eating habit. You are somebody that eats 6 times daily before, and you are now blaming your fat experience on your hormones. So we need to talk to women too when it comes to all these little side effects that we can always overlook. There's another method we call intrauterine devices. Intrauterine means we are putting something inside your womb. It's very common. The ones people know, we call it copper T. Most ladies know copper T. In fact, that copper T can act for as, in fact, 5 years and above. There's another method, there is also intrauterine, like I said, that we put inside the womb. There's another brand we call Mirena, all right? It's also an intrauterine device that we put inside the womb, and it can act for up to 5 years, 7 years, you know. And the advantage of that again is the woman does not need to worry for anything. Some women, when they're on that intrauterine device, they might not even see their menses. Some, if they see their menses, it might be a little bit more in the flow. But all these little side effects are things that women can always walk over. They are not anything difficult. So those ones, another artificial method that has to do with hormones. There are some things we call hormonal patches.
Okay.
You know, I had mentioned hormones. Those hormonal patches are such that the woman can just paste it like plaster under her arm, or she can paste it in her thigh or in her leg, and the thing will be releasing hormones gradually that will be against her getting pregnant. The other one that women are very, very conversant with is the pills, early morning pills or daily pills. Even men know it, because some men, they're the ones that buy it for their wives. You know, we call it everyday pill. COCP, combined oral contraceptive pills. They take those pills 28 days out of 28 days. They must not miss one. You know, so compliance at times is difficult, because the lady will miss one today, the next day she will now quickly take two. Is wrong. So that one too is available. Is also hormonal and artificial. So those ones are the basic artificial method. Of course, the female condom too exists. I actually brought some to show.
Okay.
The female condom exists just like the male condom, all right? The male condom, we are all sure of how it looks like. I'll try and see. You can see. This is the male condom that we are used to. It's a barrier method, and it's an artificial method. The female condom,
I'll be seeing this for the first time.
somebody should help me with this. So for the women too, the barrier method exists, which is the female condom. All right, and so she can also use the female condom.
Oh, this is a female.
Yes, so it looks bigger than the male.
Wonderful.
But they are all lubricated. So there is no complaint that, oh, I'm not, it's tight or anything. So this is the male condom, which is meant to be used when the penis is erect, so that it can stay, so that it won't come off. For the lady, this part is where she will put inside. There's a hard part. She inserts it into her private part, while her husband's erect organ goes in like this, and she's good to go. All right. So this is also a barrier method for the female. Those are actually temporary methods. They are artificial but temporary. Now let's go to the permanent method for the female.
Okay.
Like I mentioned, the vasectomy for the male. The opposite in women is what we call BTL. I'll tell you the meaning.
Okay.
B for ball, T for tree, and L for ladder. B means bilateral, all right?
Okay.
T means tubal, while L means ligation. So what we are saying is the woman has two tubes. We are ligating the two tubes. Just like I was saying, the vas deferens, we clip it up, we clip it off. So because the woman also has two tubes, fallopian tubes, that's what we are used to. Fallopian tubes is when she ovulates that those eggs pass through the fallopian tubes. But once we ligate those two tubes, those eggs cannot go, they cannot pass through the tubes anymore. So that is a permanent method. Bilateral tubal ligation, BTL. We usually use that method for a woman that has completed her family size. In the sense that, okay, she has sat down with her husband. We don't want more than 3. We don't want more than 4. Okay? Because once we tie your tubes, that's the end. If you come back and say you want to get pregnant again, you have to go and do IVF. So we need to explain all these things to the patient, and it doesn't have any side effects. The BTL does not have any side effect. Also, there are some patients, some women that have a very severe medical condition, like they have hypertension during pregnancy, they convulse, they are almost at the heaven's gate when God brought them back. For that kind of woman, if she keeps on having it every pregnancy, by the time she has had 2 or 3, we will tell her to just hang off. So for that kind of woman, something like BTL will be good for her. That's permanent. Another permanent method for the woman is what we call hysterectomy. Hysterectomy involves removing the whole of her womb. Okay? And that method is good for some women too. If it's a particular woman that has what we call fibroids, uterine fibroids, all right, and she has delivered the number of children she wants to deliver. I don't want to say numbers now. If yours is 2, fine. If yours is 3, fine. If yours is 5, just know that you spaced them. If that kind of woman has fibroids and she has completed her family size, then we tell her, don't let us just tie your tubes. Let's just bring out your whole womb. Because that method will be good for you. You will not have the risk of womb cancer. You will not have the risk of fallopian tube cancer. You will not have the risk of ovarian cancer or cervical cancer. So for the women, those are the basic methods for permanent contraception. And each individual has the type that will work for him or her. You can see I said him or her. I didn't say her alone. Now I must mention this. A lot of patients will come to me, Dr. Rabiu, thank you. You've talked to us. Tell us the method you are using. It is the method you are using that I want to use, because they believe if the doctor has chosen that method,
that is the best, the safest.
So I just smile at them and say, what works for Mrs. A does not necessarily will work for Mrs. B. So all we need to do to you is to counsel you on all the methods, pick the best method for you. So that's basically how it is. It's so simple.
With what you have said, Dr. Rabiu, you've given quite a list of options that belongs to the women, but very few for the men. I want to also believe that such is the side effects too. Although I know you're saying that the side effect depends on the body system, for instance, adding of weight, how is the woman eating, but we cannot deny the fact that we hear a lot of side effects from women when it has to do with family planning. Some will tell you they have swollen tummies. Some will tell you they can no longer walk well. Their laps are getting bigger. Their legs are swollen. Some fall sick. Some don't even eat well anymore. Don't you think we should talk about these side effects?
Yeah, like I mentioned earlier, for every drug, if at any time you buy a pack of paracetamol or a pack of anti-malaria that's been prescribed for you, just take out, there is usually a slip inside those packs that they will tell you about the drug and the side effects you can feel. Just like I said earlier, if you toss a coin, there are always 2 sides to a coin. But these side effects are very minimal. Like I was mentioning, if a woman starts complaining that she's getting fat, it is not the drug that is making you fat. It is because you are not disciplined with your diet. However, there are some methods we'll refrain from. Well, for instance, if a woman is somebody that has always had abnormal vaginal discharge, we will not want her to use intrauterine devices because she might be having more copious vaginal discharge. For a woman that has hypertension, that has diabetes, there are particular methods that we recommend for her that will even help her medical condition. For people with sickling genotype like SS, as in the C class, SS, SC, there are some methods that work perfectly for them, like hormonals. Those ones even help them to stabilize their red cell membrane, so they won't be having much crisis. So the side effects are things that are just, they are not severe at all. If anything, it could just be, you can give somebody some slight headache, that if you take paracetamol, it can go. However, some women will say, oh, when they're on this particular method, they're having some funny discharges. But when we send those discharges to the lab, they don't have any infection.
So, Dr. Rabiu, are you saying that these side effects from contraceptions for women majorly now?
Yeah.
There has been no record whatsoever of a woman losing her life due to contraception?
Not at all. People just say different stories. Some people are just, they like moonlight stories. You will tell a patient, this, and you are not even the one that used the method. It's somebody that is telling you, and you have put curry and pepper or sugar and tea,
And you
everything.
spice it up.
You know, you tell them, oh, this method. Some will say, no, when I used it, I didn't give birth again. Or some will tell you, oh, I actually used the method and I still got pregnant. Where did you go to get your method done? Did you go to a professional? So all those things, we have our medical statistics. This method is good for this kind of person, and the side effects are things that I can just say minimal. Minimal is even insignificant. So those ones complaining they are getting too fat, please let them go and watch their own diet. It's not the drug or the hormones that is making them fat. It is their own eating habit, and these methods are all over. If a method you feel you are not comfortable with, there are several other methods, and all these things are important to optimize the reproductive health of that woman, the man, and the family at large.
Dr. Rabiu, thank you. One of the reasons why women, family men as well, will not even want to. We know of men who will tell you, I would not allow my wife go through this, because we hear a lot of stories about it. The reason is because many are scared of the side effects, the aftermath, and all of this. Let me take you for your words. If you are to rate contraceptions, this is the World Contraception Day, and we are orientating the general public at this time. It's important for us to know how safe this is. 1 to 10, how safe? You know, you were the one that said reversal method, or what do men call it now? Discharge method is
withdrawal method.
Withdrawal method, rather.
Yeah.
Thank you. Is 99.9 not safe.
Yeah.
Right. How safe then is contraceptions?
Generally, all these contraceptive methods I've mentioned, whether the natural, whether the artificial, whether the temporary, whether the permanent, they are like 99.9% safe. Safe in sense of their side effect profile. These side effects are things that could happen to people not even taking contraception. You could just have what we call a temporary headache that will go under 2 hours. For the woman, if you have been bleeding for 7 days before, your menses might not just slow for 2 days. That's even a plus for you. All right. Some women might not even see the menses, and it will even improve their blood cell value, their blood level that we call packed cell volume. You know, women, because they menstruate, their blood level is usually lower than that of men. For the men, there's no side effect at all. For all their own methods that I've mentioned. Whatever side effect that is going to occur is the one that I mentioned, the withdrawal method. That the sperm can still swim up.
Which seems to be the only one that is not so safe.
So for all those women saying this, saying that, it's just hearsay. All these methods are safe. Even a lot of people have religious beliefs. Muslims, Catholic, they don't want to do some form of contraception. And they are like, are you God? God says you should go and multiply. Why are you now doing things against God? It's not about it. It's about spacing your children, optimizing your wife, optimizing yourself, and the family at large. Nobody, no country will want the citizen to suffer. You know, nobody wants harm for the people in his or her community. We want to optimize and make better the life of everyone. So all these methods of contraception are safe. I repeat, they are very safe. And the theme of this year is the power of options. It means you have several methods you could pick from. Imagine if it's just one method. That's when you'll be like, no, I can't use it. But you have the power of picking from different and several options that are available. So
thank you so very much, Dr. Rabiu Fatima. I would allow text messages and WhatsApp messages. I believe some of us out there would have 1 or 2 questions to ask our doctor today, in person of Dr. Rabiu Fatima from General Hospital Ikorodu, talking about the World Contraception Day. You know, I said it earlier that contraceptions are good depending on how you see them and depending on which you decide to go for as a family man or a family woman. And of course, on that conversation, Dr. Rabiu has been able to do justice well enough in explaining all of this. We still have some questions, but I would encourage some from our listeners there. Call us on 0904 081 1061. That is 0904 081 1061. Questions should be in line with our conversation today. Or you send us text messages or WhatsApp messages. I see some WhatsApp messages here. I will take them one after the other. That is 0904 082 1061. 0904 082 1061. Dr. Rabiu, I want to thank you for your time. But still on this conversation, talking about contraceptions, you have said that these things are good depending on which you intend to go for. So basically, if I'm not mistaken, it has to be a thing that you need to check a patient first.
Yeah.
So it should not be a thing that because my neighbor did this type of thing or my neighbor is using this pill,
Yeah.
I can also use this pill. So I want us now to talk about how patients can go through this process. We hear every time of stay safe, plan your family well, family planning, use contraceptions, but not everybody knows how to go about it.
Okay.
Most ways we have people from our localities here that will just go to pharmacists and tell them, please give me a drug. I need to use this, I need to use that. Or give me a female condom like the one I've seen today. At least I've seen one today, I'm happy. So what are the ways by which a family can decide to go through this family planning process?
Yeah, thank you very much. It's actually a very seamless procedure or method. It's something that doesn't give a headache at all. Okay, like the woman once they are even pregnant, when they come to antenatal clinic, part of our counseling for them is as soon as 6 weeks post delivery, whether it was cesarean section that they did for you or whether it was vaginal delivery you had, as early as 6 weeks after you have delivered, you can start your own contraceptive method. We need to always restate that to them. Why? I need to mention this. Once women are pregnant, in fact, the man might still be lucky in the first 3 months, which you call the first trimester. He might still be able to, do the thing in the other room. But by the time the abdomen starts getting big, most women will say, you want to kill me? So they deny their husband for a period of like more than 5-6 months. Okay. So once the woman has delivered and that blood after delivery stops, the man is ready to fire. And so you can imagine the concentration of the sperm that would have been in the man over the months. So once she's okay, the blood is not coming again. Once the man fires, in fact, you think I even be twins or triplets. So from antenatal period, we have always counseled the woman as early as 6 weeks after your delivery, come to the family planning clinic. We have in our health facility, our family planning clinic days every Thursday. There are always nurses, there are doctors that will talk to you. Even before you deliver, would have counseled you on the different methods that will be available for you. At times, if need be, the husbands follow them for us to talk to the man too. Because we don't want, it's not just the woman's problem. Go, Joe, whatever they tell you, do. I'm okay. No, you need to talk together, sit together and say, okay, this is what we want. We've seen men actually that have offered themselves for vasectomy. Though it's very rare, maybe but we've seen them and we are like, wow, you are really a very, very important and wonderful person. So, but the methods much more available are those women's own, but the men's methods are also available. So the counseling goes on every day, every time. It's not only just what contraception day we talk about contraception. So when we have the opportunity, when we go for outreaches too, we tell men, we tell women.
Okay.
All right.
Yes. Before I let you go, Dr. Rabiu, I must tell you that I enjoyed every bit of this conversation. Coming down to WhatsApp now. First off, I think the first message we have here. This person wants to disagree with your 99.9%. He's saying this person wants to stay anonymous.
Okay.
But I can already see the name from
No problem. No problem.
But let's save the name. This person is saying that he personally uses the withdrawal method, and it works for him for so many years. I swear to, okay, you don't have to use that word, but he says that this works for him for 100% and he has been using this for a very long time. Okay, that is one. And then we have Sholaja here saying, good morning, Ma. And Adebambo, this withdrawal of a thing had it been my way, as it had been my way for over 7 years, but I never made a mistake once, and my wife would not have any pregnancy. Why would you say it's okay? This second person too, he's still saying the same thing, but so two people now are saying no, it's not 99.
Yeah, let me address that quickly. Mr. Sholaja, Mr. Anonymous, I appreciate your input. That is your own experience, and maybe even when there are skills, there are some people that they are best at some skills. There are some men that immediately they withdraw, they tell the woman, go to the toilet, go and use Dettol, go and use soap, and go and wash all that place.
That's double check.
Exactly. So they are not telling us the other details. Then this withdrawal method, they call it coitus interruptus too. What it means that it might even be at the peak of when the woman wants to start climaxing, you know, when she wants to achieve her orgasm. That's when the man withdraws. But who cares about the enjoyment of the woman? Once the man has released whatever he wants to release, the show is over. How many women will actually come out and say, oh, sorry, I still need more? You know? So he might have voted for Mr. Sholaja. There might have been other maneuvers they applied that they didn't tell us. The withdrawal method we said is very safe, but the failure rate is very, very high. You know, it would have been lovely if we had people that told us about their method and it failed. Because what works for Mr. A, like I said,
might not
work for Mr.
Let's
B.
take just one more message from here. This is Femi Farms also attesting to the fact that it works for him. He said his own is 100% actually. And he's saying that he would appreciate if you help him with female
No, you can come. You can. Yeah, we have. The good thing about this thing is the government has provided some of these things very free. In fact, basically most of them are free. It's FOC, free of charge.
So Femi Farms, you heard that. You said the withdrawal method works for you, but you need the female condoms. You can
Contact
go to
us.
General Hospital.
Yeah, family planning clinic.
Family planning clinic. Ask of Dr. Rabiu Fatima. Hold her. Yeah, she will. She will give you that one. You are a gynecologist. With what I know, what would your advice be to everyone out there listening to you? We have just a few seconds to leave. What would you have to advise people?
Yeah, what I would like to advise the general public is when we are giving information, let's sit down and see how that the person around us works for the community at large. Nobody will want to harm you. Nobody will want to see you suffer. In fact, what we campaign for is better life for everybody. So child spacing, family planning, Planned Parenthood are for the benefit of everybody, for the government, for the community, for everybody at large. Always visit your professionals for your particular method, because the method that works for A might not work for B. So try and consult your professionals. Don't go to quacks for your method, and know that there is always a method that will work for you. Stop listening to hearsays from people around you here and there. So the message is power of options are available for contraception, and is a yes with no bias at all.
Doctor, it will be very unfair if I don't take calls. I've been seeing a lot of calls. Let's take just this one. Hello.
All right.
Friday, calling from where? Friday, you have less than 60 seconds. Talk to us. Yes, go ahead.
I want to ask 2 questions.
Okay.
That one you explained about clipping the men something around perform that.
Okay.
Yeah.
What can without is there no probability that thing that they are clipping?
That it won't lose afterwards.
Yeah,
Wait, are you married, Friday?
my wife.
Your wife is with you. Okay, we'll answer your question. Okay, let's just
Thank
answer
you,
that
Mr. Friday, for calling on a Thursday. We appreciate you. The method is vasectomy again. He's not going to lose. That's why it's been done by professionals. When we tie it and ligate it, it's going to just heal. It's just like putting a wound, and the wound will heal. So it's not going to recanalize. So it doesn't have any failure rate.
Okay, last call. I have to just take this one too. Hello. Talk to me real quick. What's your name? Femi Farms. You say you want the female condom, and you say
Yes, sir. I'm listening to you.
Sorry for this. Your profession make you spoil on the head.
I'm listening to you.
hello. Okay.
I didn't even understand what you said.
That is the same man that actually
Okay.
said he wanted the female condoms. But this is how far we can have it today on the issues. Please, for every family person out there, it's important that you have a family planning. It's important. Yes, we know that our religion will support us to stay fruitful, multiply. Then wisdom, they say, also is profitable to direct. The issues today is very, very important. Thank you so very much to our gynecologist from General Hospital Ikorodu,
You're welcome.
Dr. Rabiu Fatima. We hope to see more of you.
Amen.
This is how far we can have it. My name is Opeyemi Adebaba. God bless you.
Yeah.